So before we discuss what IVF or in vitro fertilization is, we should perhaps talk a little bit about natural conception. So that there is successful natural conception, we need to have a robust ovulation process. This is a process by which an egg is released from the ovary, normally on a monthly basis. We also need sperm of good quality. Sperm of low count or sperm of low motility will not allow fertilization. We also need healthy tubes. The tube is there to collect the egg from the ovary when the egg is released, and is there to allow passage of sperm from the uterus into the tube so fertilization can occur in the tube. IVF is essentially a process or treatment during which the location of fertilization is changed. It's no longer in the tube, in the fallopian tube. The fertilization occurs in the lab in a dish. So the first cases of IVF were meant to treat women with blocked fallopian tubes. If the fallopian tube is damaged, it cannot collect the egg that is released from the ovary, and it cannot allow passage of sperm into it, and therefore fertilization cannot happen in the tube. But once we started treating couples with all sorts of fertility issues, we realized that it can also help in the case of men with low sperm count. By putting the sperm in the dish with the egg and saving the sperm the need to swim through the uterus into the fallopian tubes to fertilize the egg, we increase the chances of fertilization. Finally, we found that couples who have normal ovulation process, normal fallopian tube, normal sperm count, and suffer with what we call unexplained subfertility can still benefit from IVF treatment. So IVF treatment can be carried out using the female natural cycle. During such cycle, only one egg is matured and only one egg is retrieved. The other way of doing this is to give the women medication to cause maturation and collection of several eggs. It appears that this second method is associated with a better pregnancy rate, and the vast majority of IVF treatment cycles that we carry out nowadays use ovarian stimulation. After a period of ovarian stimulation, when there are several eggs matured, these eggs need to be collected by a minimally invasive procedure that is normally done in theaters under sedation. The eggs retrieved are given to a scientist, an embryologist, who incubates this sperm with the egg in a dish overnight. The following day, the scientist looks at the fertilization of the eggs, and at this point it is already possible to put back one or more fertilized eggs, but normally we keep the fertilized eggs in the lab for a bit longer to see how the embryos develop, and then we transfer on day 2, 3, 4 or 5, 1 or 2 good quality embryos back inside the uterus. So the first part of treatment, the part during which the female partner takes medication to mature several eggs, or the part during which we just monitor the natural cycle, takes about 10 to 14 days. During this period, the female partner will be requested to come for a few scans to monitor the development of her follicle or follicles if it is a stimulated cycle. The egg collection is a day case procedure. It takes half an hour, and you're expected to spend 2 hours in the unit before you can go home. As I earlier said, it takes between 2 to 5 days after egg collection to transfer the embryos, and then about 10 days to know whether you're pregnant or not. The whole process should take you around 28 day times between the start of the process and until you know whether you're pregnant or not. The cost of treatment varies between patients and between clinics. Not all patients need the exact same treatment, and therefore the cost may change. And some units charge more for the same services than others. My advice to you is to contact your clinic and get a cost estimate for the specific treatment you're going to need. So generally speaking, once you hit the age of 45, the chances that IVF will result in the birth of a baby is estimated to be around 1%. The success rate of IVF treatment is age dependent, mostly female age dependent. Men's age play a role, but the role is not that significant. Under the age of 35, the chances of live birth resulting from a single IVF treatment cycle are estimated to be between 40 to 50%. Once you get to the age of 38 to 40, this halves and is around the figure of 20%. Between the age of 43 to 44, this drops to 3 to 5%. And as earlier mentioned, at the age of 45, 46, you're looking at only 1% chance of having a baby as a result of a single IVF treatment. Obviously, these figures refer to IVF treatment during which you use your own eggs. Once couple opt for egg donation, the chances of pregnancy are much better, even when they are 46, 47, 48, 49.